Hey guys, in today's video, we'll be answering a few of the frequently asked questions on breast reduction that we find on the internet. So we searched the Google space and we saw as to what are the common questions that patients are asking for breast reduction. And these are also the similar questions that I get during a consultation. So let's go ahead and check out this first video on the FAQs on breast reduction. I am Dr. Saumil Shah. I am a plastic surgeon, director of plastic surgery at Skinzone Aesthetics in Borivali, West Mumbai. Scars in plastic surgery is something that we want to avoid most of the times. But there are times where they cannot be avoided, but we make sure that they are sort of hidden when you even wear a bikini. That is how the scars are sort of made. Now in a breast reduction surgery, we are not only reducing the inner breast tissue, we are also reducing the skin in the lower part of your breast. Another thing that we are doing is we are raising your nipple and areola at a higher level than what it was earlier. To do both of these things, we need to make cuts so that the nipple areola can be rotated upwards, plus the lower part of your breast can be reduced. When we cut into your skin, there is going to be a scar. There is no way in the world where we can do the surgery without a scar. So yes, you will have scars. They can either be just around the areola, which is the dark portion of your around your nipple, and the normal skin of your breast. So this usually is not very visible, or it can be what we call as a lollipop scar, which is around a round incision around the areola and a straight one going down onto the undersurface of the breast. So this is the most common way breast reduction surgeries are done. If you have a surgeon who prefers a T incision, you might also have a horizontal scar. Or if you have big breasts, we may give you a J-shaped scar or some other different scar. But all of these scars will be hidden even in a bikini or a two-piece swimsuit if you wear it. This is a very nice question to ask. A lot of women come to us that we want a breast reduction, but we also want a breast lift. Now the way I do surgeries or I do breast reductions, most of the times, heavier breasts themselves are anyways very sagging, what we call as ptosis of the breast, that is sagging of the breast. We anyways during reduction do a procedure where we sort of what we call as coning of the breast, so make the breast into a cone, our cone is, and lift the breast up. So yes, during a breast reduction surgery, you will definitely get a lift. We also change the orientation of where the nipple areola is placed. Usually in a big breast or a sagging breast, it is placed looking downwards. We change the position and the orientation so that it starts facing forwards. Pain is something that everybody is worried about, maybe during or after the surgery. During the surgery, of course, you're not going to feel anything or know anything, you're going to be under general anesthesia. After the surgery, we make sure that you are as comfortable as possible. We'll be giving you a lot of painkillers and other things to numb your pain. We also give specific injections at the end of the surgery, which are called as blocks, in a way that the pain post-surgery, at least for a day or two, is very less. You may still have a little bit of soreness if we are adding a little bit of liposuction on the sides of the breast or underarms. Or sometimes you may feel like a pulling sensation or a filling sensation on the side of your breast. So there may be pain, but it's not going to be too much or unbearable. And we usually ask you not to restrict any work that you do in your day-to-day life. Side effects of a surgery. So there is no surgery or there is no procedure in the world that has no side effects. But the side effects with the breast reduction surgery are more superficial, as the breast is an organ that is outside the skeletal structure of your body and does not relate to any internal organs. Now, the most common side effect with a breast reduction surgery is what we call as seroma, which is filling up of fluid inside the body. This is also the most common side effect of any surgery anywhere in the world. The second most common side effect would be hematoma, which is a collection of blood somewhere under the sort of the operated area. Usually, unless both of these are quite big, the body reabsorbs them and nothing needs to be done. If the seroma is very big or the hematoma is very big, we may take a needle and just drain them out. Another common side effect is the stitches sort of just opening up a little bit. Sometimes, especially when we do very large breast reductions upwards of 1 to 1.5 kgs a side, then when we have to gather a lot of skin and the skin is very loose, sometimes yes, the skin can open up and it may take a little longer for the skin to heal, but usually this does not require secondary procedures and we can just sort of wait for the skin to heal on its own with the regular dressings that may be needed after the surgery. These are the most common side effects. Sometimes and very rarely, you may have the nipple and the areola losing its blood supply, which is a devastating side effect. It can happen and it's something that you need to speak to your doctor as to what are the chances of it with the different techniques that are done and with the different problems that you may come to him with. So that's it for today's video. I'll answer a few more questions in the second part, so do check them out. If you have any other questions, put them down in the comment section below and we'll try to include these in the second video as well. Or get in touch with us if you have something that you want to ask us personally.